Okay, so what comes to your mind when somebody mentions cancer? Some people think it's a death sentence, and maybe they are right, maybe they are not. Because cancer accounts for 9.6 million deaths annually, which happens to be the second most leading cause of death. Now, cancer is a large group of disease that can start in almost any area or tissue of the body, organ or tissue of the body, and the abnormal cell growth is so uncontrollable that it will spread to other invading organs, other surrounding organs, and invade them.
First, genetic syndrome such as Bloom syndrome and Werner syndrome. This is gotten from parents by some children at childbirth. Secondly is physical and chemical agents such as smoking, asbestos, that's inhaling asbestos, all these people that do silly, and intake of carcinogen, which can be found in most drinks we take. Thirdly is our lifestyle. What do I mean by lifestyle? Alcoholism, diet, most especially in this diet, excessive intake of red meat. Fourth, hormone, most especially insulin booster. Yes, especially metformin, because that's the one most of us do buy and take. Excessive intake of it can cause cancer. Remolut M for hormonal imbalance, excessive use of it, because some of us abuse drugs. The fifth leading cause, infection and inflammation by certain kinds of viruses, bacteria, and some parasites. Sixth, radiation from the sun. Some of us spend hours walking under the sun. It is very, very cancerous. Seventh, this one is a rare cause anyway, organ transplant, most especially kidney transplant. Sometimes the kidney that is being replaced with the former kidney may not be compatible to the person, so sometimes it could be cancerous. Talking about symptoms of cancer, they vary widely depending on the person's body system. In some persons, they may not even occur at all until they have gotten to a very advanced stage. Some patients, on a general sense, they could experience abnormal bumps, unexplained fevers, night sweat, or even unintentional weight loss. I'm going to streamline some types of cancers and their symptoms, most notably breast cancer. The patient may experience lumps in the breast, bloody discharge from the nipples, changes in the shape or texture of the nipples or the breast. In prostate cancer, a man can experience something like difficulty in urination and difficulty in bending. In colon cancer, one can experience things like changes in bowel habits, changes in stool consistency, changes in blood in the stool and abdominal discomfort such as abdominal pain, anemia or fatigue, though this is more of a colorectal cancer. Another one is basal cell cancer. This one appears as a white waxy bump or a brown scaly patch on sun-exposed areas such as the face and the neck. Lung cancer. This one, bloody cough with phlegm, chest and rib pain, wheezing, weight loss, frequent respiratory infections, and this is mostly caused by excessive smoking. So smokers, please take note. Melanoma is another one. This one can occur anywhere in the body. There could be a new unusual growth or a change in an existing mole. Another one is lymphoma. This one you have swollen lymph nodes, excessive fatigue, and weight loss. The last one I'll talk about is leukemia. This one you'll be treating infections, frequent infection, any kind of infection that passes on air, you catch it and you keep treating. Another one is easy bruising and bleeding. You easily get injured by any little thing and you bleed so profusely that you will lose a great quantity of blood. Another is pale skin. You get so dried up and you start shining white, drying up as if you are under some form of spell or something.
Cancer treatment depends on the stage of the cancer patient. It can range from chemotherapy, which has about 4 to 8 cycles of treatment, from which you can take breaks, to radiation or surgery. The surgery may include palliative surgery, which is to reduce the size of the cancer, or it can be electrosurgery, where we use electricity to kill the cancer cells, or it can even be supportive surgery, where we support the other medications or the other cancer therapy that has already been taking place. Chemotherapy involves the use of drugs to treat cancer. The choice of drug may be dependent on the mechanism of action of the drug, or it can be dependent on the type of the cancer the patient is suffering from, or it can be dependent on the stage at which the cancer patient is at the moment. Classification of chemotherapeutic drugs may include alkylating agents, which has about 5 subgroups, under which we can have drugs like triazine, dicarbazine, or we can have semustine or lomustine. The second classification is the antimetabolites, which include the folate antagonist methotrexate as well as the pyrimidine antagonist 5-fluorouracil. The third classification is antibiotics such as doxorubicin and bleomycin. The fourth are plant derivatives such as vinca alkaloid, vincristine, and vinblastine. The fifth are immunomodulators such as levodopa. The sixth are hormones or hormone antagonists such as anti-estrogen, tamoxifen, or glucocorticoids, prednisolone. Finally, there are miscellaneous anti-cancer drugs such as cisplatin and mitotane. But it is necessary to remember that there is no best treatment for cancer. The best thing you can do is to prevent having it in the first place. It is true that cancer can be genetics mostly, but it also can be as a result of the food we eat. It also can be as a result of the lifestyle we live. Those who smoke tobacco, those who eat processed food. Remember that you are exactly what you eat. If you do not eat food as medicine, you're going to end up eating medicine as food. Thank you.
Now, why should you and must you avoid cancer? Well, do you love your life? If yes, then yes, you may want to avoid cancer. I'll be listing out some preventive measures that will help you to stay away from this so-called deadly disease. The first one is to maintain a healthy diet. Now, if your body mass index is giving 25 to 29.9, you're overweight. If it's giving 30, my dearest, you're obese. So if you're in this range and category, you might as well try to, bring it down and watch what you eat. So you can also, maintain an healthy diet. Yes. Now most of us, we eat a lot of things that's carcinogen inside. A lot of this canned food and so-called foods that we eat nowadays. You might as well try and eat more fruits, vegetables, the organic one especially. Then another one is to exercise regularly. I know some of us might not go to gym and do the cardio exercising and all, but you could just stroll within your compound, jog around just to keep fit. Then another one is for those that smoke. Please avoid the use of tobacco and other carcinogenic materials. Then another one is to stop drinking or avoid or drink moderately. For those that cannot avoid, yes, you can drink moderately, just one bottle per day. For those, then please protect yourself from sun by using sunscreen. Avoid tanning. I know there are some people that they want to be black. All those things contains carcinogen.